Hello, my name is Shin, and today I'll be presenting on leprosy, also known as the Hansen's disease. Here's the table of contents. In this presentation, I'll be covering four key areas: what is leprosy, its mechanism, prevention, and treatment. Let's start with understanding what leprosy is. Leprosy or Hansen's disease is a chronic infectious disease caused by Mycobacterium leprae. It primarily affects the skin, peripheral nerves, mucosal surfaces on the upper respiratory tract, and eyes. Symptoms include skin lesions, nerve thickening, numbness, muscle weakness, and eye issues that can lead to blindness. Leprosy is classified as an NTD, a neglected tropical disease. Although it is rare, leprosy still exists today, occurring at all ages from early childhood to old age. Leprosy is a Leprosy is an NTD that still occurs in more than 120 countries, with over 200,000 new cases reported annually. It is common in parts of tropical and subtropical Asia, Africa, Central and South America, some Pacific countries, and parts of the USA. The majority of annual new cases are detected in Southeast Asia. India has the highest number of cases, followed by Brazil and Indonesia. Approximately 208,000 people globally have leprosy, with most cases in Asia and Africa. In the United States, about 100 people are diagnosed with leprosy each year. Brazil, India, and Indonesia report more than 10,000 new cases each, and 13 other countries report between 1,000 and 10,000 new cases, while 45 countries report zero cases, and 99 countries report fewer than 1,000 cases annually. Main symptoms of leprosy include skin lesions, nerve damage, and advanced symptoms such as stiff, thick, or dry skin, growths on the skin, disfiguring skin sores, lumps or bumps that don't go away, lumps or swelling on your face or ears, loss of feeling in affected areas leading to injury risk, muscle weakness, vision problems leading to blindness, loss of eyebrows and eyelashes, sores on the soles of the feet that don't heal, pain, redness, and burning, deformities of the nose, hands, and feet, and lastly, paralysis of feet and hands. Now, now let's explore the mechanism of how leprosy affects the body. Leprosy is caused by Mycobacterium leprae, a slow-growing, rod-shaped acid-fast bacterium. M. leprae tends to thrive in cooler body areas. For diagnostics, slit skin smears are often collected from the earlobe. Once inside the body, M. leprae targets macrophages, immune cells that engulf pathogens, allowing the bacteria to survive and replicate within them. M. leprae also targets Schwann cells in the peripheral nervous system, which produce the myelin sheath insulating nerve fibers, leading to nerve damage. The bacterium spreads primarily through respiratory droplets from an infected person and can enter the body through the respiratory tract, skin, or mucous membranes. Leprosy spreads through nasal mucosa via droplets from nose and mouth. When an infected person coughs or sneezes, droplets containing bacteria can be inhaled by others. The bacteria can also enter through open wounds on the skin. The incubation period is 3 to 5 years for symptoms to appear after contact with the bacteria, though it can take up to 20 years in rare cases. Now let's discuss the prevention of leprosy. The BCG vaccine, primarily used against tuberculosis, also provides some protection against leprosy by boosting the immune system. It is given to individuals in leprosy endemic areas, particularly children. Chemoprophylaxis involves administering antibiotics such as single dose rifampicin, SDR, to high risk individuals, especially close contacts of leprosy patients. These antibiotics target and kill Mycobacterium leprae before they can establish an infection. Other preventive measures include enhancing sanitation and cleanliness, avoiding overcrowded living conditions, ensuring a nutritious diet to strengthen the immune system, and regular health checkups for early detection and treatment. Public education about leprosy symptoms and transmission, reducing stigma, and providing immediate multi-drug therapy, MTD, to those diagnosed are also essential. Finally, let's look at the treatment for leprosy. Leprosy treatment involves multi-drug therapy, MTD, which lasts 6 months for paucibacillary PB cases and 12 months for multibacillary MB cases. MTD eradicates the pathogen and cures the patient. Early diagnosis and treatment can prevent disabilities. PB leprosy, with no detectable Mycobacterium leprae in skin smears, is treated with rifampicin and dapsone for 6 months. MB, lep- MB leprosy, with detectable bacteria, is treated with rifampicin, dapsone, and clofazimine for 12 months. Monotherapy should be avoided to prevent drug resistance. Dapsone is a bacteriostatic antibiotic that inhibits the growth and reproduction of Mycobacterium leprae. It is crucial for controlling and reducing the bacterial load in leprosy lesions and works synergistically with rifampicin by inhibiting bacterial synthesis of dihydrofolic acid, which is necessary for nucleic acid synthesis. Rifampicin is a bacterial antibiotic that kills Mycobacterium leprae by inhibiting RNA synthesis. It rapidly reduces the bacterial load and is highly effective when combined with dapsone. Rifampicin works by binding to a beta subunit of microbial RNA polymerase, thus impeding RNA synthesis. Clofazimine is a bactericidal agent that disrupts bacterial DNA and inhibits microbacterial growth. It exerts a slow bactericidal effect on Mycobacterium leprae, inhibits its growth, and binds preferentially to its DNA. Clofazimine also has anti-inflammatory properties that can help control erythema nodosome leprosome reactions. Thank you for your attention. The information provided in this presentation is based on various scientific sources and research. Thank you for listening.